being able to go to the gym or go for a run, and I still, to this day, I'm still going, oh, have I taken my treatment? And then I go, oh no, I don't have to.
This is Luke Pembroke, and he has just become one of the first human beings in history to ever cure his hemophilia, a condition where your body can't appropriately make blood clotting factors. As a result, you start experiencing bleeds in your joints, under your skin, in your mouth, and gums. And these bleeds can be basically due to any minimal trauma that a normal person with normal blood factor levels won't suffer anything from. To get a better idea and to understand blood clotting factors, one relatable example is blood collecting tubes that you probably have seen one at least once in your life. They come in different colors, but for the purpose of this vid, we're only interested in the one that has a purple top, because that's the one that comes fresh out of the factory with EDTA in it. This substance binds calcium ions in the blood and basically inactivates them. Blood clotting factors need calcium as a cofactor to activate the coagulation cascade. No calcium, no clot formation, and the blood sample the nerves collected from your vein can now be transferred in its liquid state and be further tested in the laboratory. Now imagine a person whose blood is constantly in this hypocoagulable state. I mean, stuff as simple as being hit with a football or being injected with a needle to get your flu shot can lead to such skin bruisings and hard to stop bleedings in hemophilics. Not only that, but bleedings can also be spontaneous without any apparent cause. Take the story of Alexei Nikolaevich as an example. Born to Russian Tsar Nikolai II and Queen Victoria's granddaughter Alexandra to inherit the Russian crown in 1904. Unfortunately, Alexei was diagnosed with hemophilia, which was basically a death sentence back then. This is him with his parents, and he's being cared this way because his knees were so swollen from bleeding to the point that he basically couldn't even walk. If you didn't know about Alexei's story, I highly encourage you to read more about it and how his disease ended up with other factors to provoke the Russian Revolution in 1918 and end the Russian Tsar ruling era. But for now, of course, through the years, we have managed to come up with various ways and methods to combat hemophilia, like injecting patients with the clotting factor their body couldn't make, or most recently developing a monoclonal antibody, emicizumab, that does the same job as factor VIII in patients with hemophilia A. And there are also other treatments and compounds currently in research and development that all basically aim to do the same job, which is to replenish the missing clot factor level to near to normal levels, or at least to levels above the bleeding threshold. But the problem with all of these treatments is that they're all considered a prophylaxis, a preventative measurement that hemophilics need to adhere to minimize as much as possible the incidence of annualized bleeding rates, or ABRs for short. And I said minimize because none of these options currently guarantee the absence of bleedings or spontaneous bleedings. And from here rose the need for a new cure that solves all of these problems. And thankfully, hemophilia is a great candidate for this newly developed, newly rising technology, viral gene therapy. And I made a video about viral gene therapy back in August, when it was just FDA approved for the cure of beta thalassemia at the time, I think. And it was a huge news. I will make sure to post the link for that video in my description. You can go watch it if you're interested. But for now, take a look at this graph, for example. It shows how often hemophilics should inject themselves with the factor VIII or emicizumab, the monoclonal antibody I talked about in the beginning of the video. Watch what would happen to their blood clotting capacity when they start abstaining from taking treatment. And yes, emicizumab doesn't require as much frequent injections as factor VIII or even EHF, which is basically elongated half-life factor VIII. But it comes with a heavy price, $500,000 to be exact, and again, doesn't guarantee the stop of spontaneous bleeds. Now, look at the same graph, but this time for Hemgenix, the gene therapy I was talking about. Keep in mind that the y-axis reflects the activity of factor IX, the missing factor in hemophilia B. This is a hemophilia B cure. And this is the patient's factor IX production at baseline. Understandably, it's less than 2% of what a normal person is able to produce. And following a single dose of Hemgenix, their liver cells acquired an autonomy in terms of synthesizing factor IX that's well above bleeding threshold. And it's hard to appreciate how much of a life-changing event this is for those 54 participants. I mean, their whole life and daily routine was based on this energy-consuming protocol of how much to take of factor IX and when to take it. But now, following a single dose, a single injection of Hemgenix, they can basically forget about hemophilia and don't think about it ever again. And remember the annualized bleeding rate, the ABRs? Well, the 52 participants also reported a whopping 62% decrease compared to the time they were taking just factor IX preventative therapy or emicizumab. And the good news is, the cure was completely safe. I mean, there was a small incidence of side effects, but it's really not worthy of mentioning, especially compared to the benefits this cure brought. You may be watching right now and thinking to yourself, wait, are we on the verge of a literal medical revolution? Can't we just start applying this technology left and right to genetic diseases? Well, not so quick. I did indeed say that hemophilia is a great candidate for this technology, but that doesn't mean that any genetic disease is, and there's a good logical reason for that. Well, to begin with, hemophilia is a monogenetic disease, which means there's only one faulty gene responsible for the abnormal production of clotting factors. Compare that with multi-genetic diseases like alpha thalassemia, for example, which in this case, two faulty genes lead to the formation of abnormal hemoglobin. And that's actually one of the reasons why Zynteglo, the compound I made a video about, got developed for beta thalassemia, because in contrast to alpha thalassemia, beta thalassemia is a monogenetic disease, just like hemophilia. And finally, before telling you the downsides of gene therapy, let me briefly tell you about how it works. Well, first things first, gene therapy is a broad term. CRISPR, the long-awaited gene editing technology, is a gene therapy. Cell therapy, the therapy often used in hematological malignancies, is also considered a gene therapy. But what we're using for hemophilia and what we use for beta thalassemia is what's known as vector-based gene transfer. The mechanism of this is very complex, but in a nutshell, we use a transporter. In many cases, that would be a virus, that would be our vector. And we strip that virus of its harmful antigens so that it's no longer harmful for the human body. We load that virus with prepared DNA and infect our cells with it. In this case, the virus will travel to the liver cells and inject its genetic material to hepatocytes, the liver cells. Viruses are really good at that, don't worry about it. Those liver cells will now acquire the ability to produce factor IX because we reprogrammed them, basically. The vector for Hemgenix is from the adenovirus family, and that's actually why influenza-like illnesses was a common side effect, experienced by 13% of the participants to be exact. Now, what do I not like about gene therapy? Well, first of all, the price. Well, I think nothing to add about that one. Secondly, the fact that a lot of people have already been exposed to adenoviruses and they have circulating in their blood activated antibodies towards those viruses. And that makes it impossible to deliver the gene with this technology with that particular virus or that vector. And in fact, one of the pre-treatment testing is AAV antibodies, which stands for adeno-associated viruses antibodies. And indeed, if we take a look back at the paper, participants with high titer of AAV5 antibodies were one of the two groups which was basically non-responders to Hemgenix. Thirdly, there is still a persistent fear in the medical community that the newly programmed hepatocytes, liver cells, that their capacity to produce factor IX, their acquired capacity, will slowly and gradually wear off and disappear. Remember the chart I showed you before? Well, when we continue monitoring the patients till month 18, we could clearly see that the factor IX production has slightly decreased compared to month 12. And we don't have the slightest idea what would happen next. Listen to Dr. Mark Reading explain this issue.
Maybe the million-dollar question, and that is, how long is this going to last? We know from the data that's been presented already with these gene therapy for hemophilia treatments that The factor levels tend to decrease over time. We don't yet know how that's going to play out. Will they eventually go all the way back down to baseline? Will they level off and stay stable above a previous baseline? How fast that happens, how long that's going to last, and how it might vary from person to person. These are all really important questions that we're working on getting the answers to with these studies that are ongoing. Currently, we can't just redose you with the same vector based on our current technology. So if you've got a gene therapy treatment right now and it wore off, we can't just give you a booster shot. As you've heard in the news now with the COVID vaccines, we can't do that with this based on our current technology. We'll need to figure that out as well if this isn't a permanent fix.
So that's it. I hope you found the video informative. I personally am optimistic for gene therapy, and honestly, with all the increase in the medical research community we've been seeing lately, I can't wait to see what the future holds for us as Homo sapiens continuing to evolving and thriving. And as always, stay safe.